Okay, Assalamu alaikum, everybody.
Oh,
Welcome to our Women's Health Matters discussion. Um, I'm going to give everybody a minute or so to hop on if you're hopping on live. Thank you for joining us. We haven't had our Women's Health Matters discussions on here for a bit, so we're really excited to get these started again. And this month it is Domestic Violence Awareness Month. October 10th was actually World Mental Health Day, and we really thought that this was a timely discussion to have. And for those of you who are not able to watch live, we hope that this information benefits you whenever you are able to see it. So thank you all. Thank you all for joining us. We're just going to go ahead and get started because this is a lunch break for a lot of people. So we want to finish this up before the 1 o'clock hour and just dive right in, inshallah. So I wanted to start really just with a bit of a background about why we're doing this conversation. My name is Sadaf Saeed, and those of you who um, are connected with MWO may already know that I am a breast cancer survivor. So I think this subject is really important. I found out after one of our MWO pink parties where they said you should be getting a mammogram at the age of 40. So I went and I got one, and then there you go, I found out. So I think it's really a subject that's dear to my heart because I think the more we all know, the better we can take care of ourselves. And it's not only me that's impacted. Uh, there are currently more than 4 million women with a history of breast cancer in the United States. That means there's 4 million women that are living with this disease or have been treated for it. And that's a lot of women. It impacts so many people. It says around 30% of all newly diagnosed cancer cases are breast cancer cases. So this is something that is impacting us a lot. A lot of times, um, so many of us know people that have had breast cancer. Actually, within our team, we have several people that are breast cancer survivors. So we just want to talk about it, and this Women's Health Matters discussion is going to focus on a different aspect of it. We're going to be talking about mental health and self-care. So I'm really excited to have with us Abila Haq. Abila has a familiar face. I think you may have seen her through the years. She's hopped on and helped us a bit for different conversations. Abila, I'll give her a chance to introduce herself, but she is a licensed mental health counselor and a resource in our community. And Abila has support groups and conversations she has about health in particular. So we're really excited to be partnering with Abila this year to host a series of conversations about really taking care of ourselves and taking control of our health care and our needs. So welcome, Abila. Abila, can you just introduce yourself real quick?
welcome. Thank you so much, Sadav. I was very excited to be here. I'm very grateful to be here. Like Sadav said, I am a licensed mental health counselor. I have been in practice for over about 20 years in the state of Florida. Um, and I specialize in health psychology and working with autoimmune related issues and psycho-oncology. So that's the professional part, but personally, this topic is very close to my heart. About 5 years ago, I lost a dear friend, childhood friend, my sister, uh, who I was my sister friend, who I was very close with from growing up, from breast cancer, and it was due to late diagnosis and just her journey. So I advocate when I'm able to and speak about this topic as much as I am. And definitely the mental health component is a big factor when you're dealing with any chronic health related issue, specifically cancer as well.
Thank you. And and I think that's when I first really started hearing a lot from you is the support group that you created. And I think that's such an important space because when we are struggling with our illness, so many times, whatever illness that is, there's this feeling of just being alone, really going through it alone and thinking, for me, it was like not knowing how many other people are experiencing the same thing, and I think there is so much strength that you can get from talking with someone and being with someone that understands what you're going through. So I really think that this is important work that you're doing, Abila, and I thank you for creating those spaces. I think those are vital.
Thank
Um,
you.
what I wanted to do today in this conversation is really talk about the journey of a woman. We're the Muslim Women's Organization, so this is for women in particular, but there are men that get diagnosed with breast cancer. But for us, we're talking about as Muslim women or survivors in general. This journey that you go on, suddenly you're living your life, everything is kind of normal, right? And then you get this news, this big news that you have breast cancer, right? And for me, it was just even getting diagnosed, you have to go through some tests, some really stressful tests, right? And just between getting a biopsy and getting that diagnosis even is just such a difficult week or so, not knowing what's to come. But just that moment of being diagnosed, I think, is a very difficult experience. It's so traumatic. And I think it's important for those who are hearing this news to have someone to go to. I remember when I found out, I was meeting up with one of my friends for lunch and I just broke down and I started crying. But immediately after that, I just put all of my emotions away. I have this little box that I lock them up in my head, and I'm like, okay, what do I need to do? I'm going to do it. And then I don't think about my emotions, what I need, what I'm going through, none of it. I'm kind of on automatic cruise control, just doing everything that needs to be done without really taking care of myself at all. And I wanted to ask you, Abila, like what do you recommend for those people in that moment that they're getting diagnosed or they're going for testing and they suddenly find this out? Can you just talk us through just some of the tips
Sure.
that you may have for them and advice that you have?
Sure. So it is undoubtedly a life-changing event. Any condition, any cancer diagnosis, but specifically when you're looking at breast cancer, I think there's no way to prepare for something like this. There's no preparation. Um, I think the most important thing is to recognize that um, find your support system in that moment, like you had your friend to reach out to. Um, and that is a normal experience where you kind of compartmentalize and put things aside just so that you can deal with what you need to deal with. And so the emotions do get put on the back burner sometimes because they are such heavy emotions. So, first off, I want to say is that, again, there's no preparation, but be aware that this is going to change your life. I look at it as a transformational opportunity, an opportunity for you to look at, okay, your priorities shift, a lot of times when you first get diagnosed, it can be, like you said, very sudden, and you could be just going for a routine testing, and then you get the news that you have a cancer diagnosis. So it's how you respond to the situation, right? Emotionally, mentally, physically, and spiritually. How are you look at all those areas, and you take a moment. I always encourage everyone, whoever is going through the journey of just getting any testing done, because it can be very anxiety provoking, to sit down and do some self-reflection. Journaling is a great opportunity to have that personal sacred space to write out your feelings, because it's not always easy to talk to your family members, especially culturally. That could be a big component as well. We're never taught to open up and share our feelings, and express ourselves. A lot of times culture plays a big part in that. Uh, so I think we do tend to become task oriented, and it's okay, because sometimes you need to focus on, okay, you're getting testing, and then the doctors are going to be speaking to you about treatments. A couple of things that I would encourage someone who's going through that process, and the initial process is always find that one support system, whether it's a friend, a family member, a counselor, someone that you can reach out to and have that open space, and share that, um, share your feelings with, because you need to have space to emotionally release all the stress and all the anxiety and just talk it out. You know, um, if you are able to um, take time for self-care, you know, practice the daily self-care things that you are able to do, prayers and meditations, and um, you know, that can be a big source of support and relief. And the other part of it is the more solution oriented way of looking at things is, okay, you know, take a journal with you when you're talking with your doctors. A lot of times the conversations we have with your physicians and the way you're being communicated, it can be very overwhelming and very stressful. Not a lot of the language is easily understood. So ask questions, you know. That's one of the biggest components, because it's a shock to your system. You are going through shock, right? So there's the traumatic and distressing experience of being diagnosed. So having a sense of normalcy, recognizing your support system would be one. Um, Meditating and praying, you know, grounding yourself, and to help relieve the anxiety, the day-to-day anxiety, and keeping a sense of normalcy as well, like your day-to-day routine, you know, that is important, with family, with friends, um, and then of course communication with your medical team, you know, keeping a journal, a notebook, asking the questions that you know that you don't understand, language that you don't understand, treatments that you don't understand, because a lot of times these are very aggressive treatments, especially with breast cancer. I have come across young ladies in their 20s having double mastectomies, full chemo, full radiation, and it is very, very traumatic. Um, and it changes your life in many ways. It changes your experience personally, internally, how you relate with your family members, you know, how much information do you want to share with external family members. You know, setting some boundaries can be a big important factor in managing that stress, because it is a stressful experience. um, so being aware of who you feel comfortable sharing your story with, that's super important.
I have another a follow-up.
Yeah.
I know that you mentioned the journaling and talking to your doctor and asking questions and communication and stuff. And I think one thing that really needs to be brought up one point is that you may need to switch doctors, right?
Yeah.
Like I
Oh yeah.
think getting a second opinion, you know, sometimes
Absolutely.
that comes with these emotions of guilt and like, I don't know, I feel bad
Yeah.
and maybe I shouldn't say anything. But I think that is such a big piece is I know like when my mom was diagnosed with cancer, um, the doctor that we went to initially that told her, he said, he sat her down. He's like, you have stage 4. I'm giving you maybe 4 months to live. This is literally what he tells her.
Mhm.
And we went luckily with one of our friends who was a physician. And he went outside. He's like, Auntie, do not listen to that man. Like, come, I think you need to go to Moffitt. They have so many different treatment options. There are other people you can talk to. Let's go there. So we made an appointment there and we talked, and mashallah, she lived a good 6 years after that initial diagnosis. But I think when you're first told something, we have this tendency to just like believe that person.
Correct.
And even though it may freak us out, make us so uncomfortable, and we don't know how to talk about it. But just can you talk a little bit about this idea of like, get a second opinion?
Yeah,
It's okay.
absolutely. Absolutely. You are your own best advocate for your body. This is a gift from Allah. This is your body. This is and so we are given guardianship over this body, right? That it's a gift from and for us. So absolutely, you have every opportunity and every right to ask for a second opinion. Don't just go if you're not feeling comfortable and something is not settling in your heart well. Always seek that extra support, you know, and go for that second opinion. There's absolutely nothing wrong with it, and you will be surprised how many times that the opinions may differ.
Yeah.
So at the end of the day, you want to gather all your information. And the more, if you, and it's not like hopping around for doctors, right? You want to go for a second opinion. Sometimes even people go for third opinions. But gather the information And you want to go into this idea of, okay, let me see, I have all the information now. Let me look at it from a perspective of, okay, which one fits best with my life, my perspective, and how I want to, which treatment I feel is going to be the most effective. And a lot of times, the treatment you may end up having to choose is going to cause a lot of distress in itself. You know, chemo, radiation, even the surgical process, and if you end up choosing to get reconstruction, it's a very long journey. It's a very long process.
Yeah,
It's
and
uncomfortable.
I think like you gave some really good tips, just taking that journal with you when you go to the
Mhm.
doctor, because I
Yeah,
know I forget
yeah.
afterwards. Like, what did the doctor say? So
And
I
that's
think,
because of the stress. That's because of the
yes,
stress, the emotional stress that you're carrying and the
yeah.
shock that you're in. It's your mind is not like it's not absorbing all the content and information completely,
And it's a
right? So
lot. It's a
it
lot
is
of
a lot.
information that's
It is
coming
a
at
lot.
us, in
Mhm.
those moments. So I really love that idea. I think I wish I did
Yeah,
that. I think, looking back, that's
yeah,
something I didn't do, and I wish I did. And I think it also helps just to be able to talk to your family,
yeah,
and
yeah.
share about
Awesome.
all of that stuff. I think it's so important. And talking about family, you did talk about boundaries and normalcy and these kinds of things during treatment. I wanted to switch over to the caregiver because
Sure.
treatment is really hard for a caregiver. I know I was a patient, but I was also a caregiver for my mom, and it's you want to just help them, right? But sometimes they don't want the help. Sometimes
Mhm.
they feel like they're a burden, and it becomes really hard because the things that are said in those moments are it's hard not to take it personally as a caregiver. And we're always trying to make those we love happy, make them the things they love to eat, make them all do, make sure that they're comfortable and everything is okay. But what we're not getting the love and appreciation back in those moments because they're going through such a hard time. So I think just how do we I know, like, I did not rest. I didn't sleep. I just kind of like did everything for my mom, which I would never do anything differently. I would still just do everything I needed to for my mom. But I do think I didn't know how to take care of myself in those
Yeah.
moments. So, do you have some advice for caregivers? Like, how can they navigate this caregiving life,
Yeah. It's yeah, caregiver fatigue and caregiver stress is a real thing. Um, and like you said, being a patient yourself, having dealing with your own health related stuff, your own issues with the cancer, and then having to be a caregiver for your mom, that's a double whammy. So the best thing that I can say is every person's different, right? Every relationship's different. So your relationship with your mom is going to be different. Your relationship with your siblings is going to be different. Being present is the most important thing because when you're dealing with cancer, it's almost like and I don't like to use this word control because I believe control is an illusion. But all the thing, it's a traumatic incident, it's a distressing incident where it's all that being taken away from you. You're being told what chemo you may need, what radiation you may need, you may need surgery. All of these things, you're being told what's going to happen to your body. You're not giving it an option. So when that happens, that sense of control is taken away. So as a caregiver, you want to allow your loved one to feel supported and your presence to be known, and giving them the respect and dignity to come to you and say, look, this is how I need you to help me. So having a conversation and saying, mom, sister, I'm here for you. You let me know what you need and I will show up. And making sure their basic needs are met. Are they eating? And a lot of times with chemo, your appetite will change. Radiation, all these different procedures and treatments will shift and change your appetite. Things, I've come across families that are like, oh, if you eat, and it's a cultural thing, right? If you eat, you're going to get better. But a lot of times with the chemo and radiation and the medical treatments, you're not wanting to eat. So being mindful of not being pushy. So recognize your own behaviors. Um, and then practicing self-care. As a caregiver, you may be dealing with running around, taking them to appointments, you know, and then having your own family to take care of. So taking time to slow down. So slowing down is important. Being intentional is important. Um, Using your support system, you know, not that every kind of delegate. Sometimes as a caregiver, the best way to provide care is delegate. Okay, you know, you bring dinner this night and this friend makes dinner the other night, and then everybody's sharing the burden, you know, so it takes a lot of that stress off of you. Um, and then emotionally, you know, allowing your loved one to have that space, because it is such an intimate journey that they're going through. There is no way to understand, even though you may be going through something very similar with your own health, it's a very intimate and personal journey when you go through cancer. um, so being present, letting them know you're there, slowing down for yourself as a caregiver, and you know, keeping up with your own basic needs of sleep and hygiene and hydration and eating food, um, you know, and not losing sight of life. You know, a lot of times when cancer, the big C word comes on the table, it's like all life stops. It doesn't have to stop. You can continue to enjoy doing things, you know, going, sitting outside and gardening, and being intentional and being mindful about it.
I love that. I
Yeah.
think that joy is so important in those times. I know that with, and I think as a caregiver, sometimes we're so protective of the person who's going through treatment, the one we love, and they want to do stuff. And we're like, no, 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 don't go. You're gonna get sick. We
No,
have
it
to be careful. And I know I would go to my mom's oncologist visits with her, and my mom would be like, and my mom would want to go teach Sunday school, right? And she just had, bone marrow transplant, all these things. And I'm like, doctor, I forgot his name, you need to tell her that she can't go to Sunday school. And he's like, why can't she go to Sunday school? Let her go to Sunday
yeah,
school. If that makes her happy, let her
exactly.
go. She'll wear a mask. She knows what to do. Just let her
Yep.
go. She needs that. And I was like, oh, I'm
And
like
that's
looking
the
for
thing. And
support.
that's the thing, is that acceptance, because there's also fear as a caregiver and as someone you love, right? And you care about, you're like, okay, don't do this. This is going to hurt you. But in actuality, that's exactly what they need.
Yeah.
They need to feel alive, because life and death become a very real, it's like in your face. You can't hide away from it. It's very tangible when you're dealing with cancer. You know, priorities shift. You know, so life becomes, and I think, you know, and sometimes it's like, you know, you go through a very distressing situation as having a cancer diagnosis and realizing the importance and value of life and the importance and value of relationships. But you know, that in itself is, I find some beauty in that and hope in that,
Yeah.
that even though, you know, you go through something difficult and tragic, it's helping you build some resilience, and you can overcome, you know, and you can still experience life in its beauty, you know.
Yeah.
And I always say, as caregivers, you know, that analogy of anyone flying on a plane, put your oxygen mask on first before you help someone else.
Oh, for
Take care
sure.
of yourself first.
Yeah, definitely.
You
And I
know?
also wanted to add, like, I know one thing that I found helpful is when I would be going to these treatments or things with my mom or even myself, there's always the hospitals that you're going through have so many resources. I
Mm-hmm.
know at the hospitals, you'll have like, I had to go, it was mandatory for when my mom had her bone marrow transplant, I had to go through a mandatory caregiver training.
Mm-hmm.
So like they at Moffitt, they made me sit through a
Good.
training
Yeah.
so that I could understand that, listen, her taste buds are not going to be what they were.
Mm-hmm.
And she will not want to eat what you put so much effort into making. Do not take it personal,
Yeah.
And so
Exactly.
like they really
Don't take
went through
anything
all the different
personally.
things. Yes.
Yeah, you learn to have you learn to thicken your skin a little bit and not take anything personally, because imagine the roller coaster that they're on
Yep.
emotionally, you
Yes,
know?
exactly. And I found those little trainings to be really
Yeah.
helpful. And then they have a
And
lot like counseling and things at the
correct.
hospitals for free, like little
Yeah.
support groups and things are there.
Absolutely. And they have a lot of like, support groups. They have, depending on the hospital you're at, there'll be support groups. There's counseling support available. There's social work support available. A lot of times you may actually, like a more practical example would be that, as a caregiver, you may have to take some time off work. So you may need help with getting some FMLA paperwork filled out, which allows you to have secure your position and your job, but also be able to take the time off you need to care for your family. So the social worker team can be a really great resource to provide you with, if you're worried about as, okay, what am I going to do as a caregiver? I have to be there for my mom, take them to the appointments, and I'm going to end up having to take all this time off work. I'm risking my job. So that can be an additional stressor as a caregiver. So, but there's resources for that. There's resources that can help you. And social work is great resource in the hospital setting. There's even insurance companies sometimes can provide social work and care navigation. That's something to look into. In the hospital, there's spiritual care support, which they're non-denominational, so you can always reach out to them. They have chapels, and they usually have a prayer area with prayer rugs for us. So there's a lot of support
And we
that you.
actually, MWO has also a chaplain. Like we have a Muslim woman chaplain who uh, this is one of the things that she's trained to do. She was trained as a clinical chaplain, really helping people deal with illness, loss, grief, all of these things, and anxiety. And speaking about anxiety, I know I've had a friend who was diagnosed, several people actually that I know that when they were diagnosed, they really needed that extra help and they needed anxiety medication, right? Because it's such a big thing to suddenly have to deal with. And I know that we have sometimes this fear and stigma like around being on a medication, right? So can you talk a little bit
Mhm.
about how what
Sure.
that support can look like for your own self? Like how do you take care of your mental health? And what are
Absolutely.
those things that might be needed?
Yeah. So whether you're a caregiver or whether you're the actual patient, right, you're dealing with a chronic stress related issue. And initially, when you first get diagnosed, it's an acute stress situation. So it's a sudden shock to your system. It's a traumatic incident. And when that happens, over a period of time, you can start developing symptoms of anxiety, symptoms of depression, um, feeling overwhelmed, low motivation, low energy, fatigue, um, sleep disturbances, even some nightmares or, challenge, difficult dreams. And so all of these are symptoms, which we look at in diagnosis as far as whether it's an acute situation, which is usually within the first 3 months of an incident, and then 6 months later, it could, if they progress, it can turn into um, PTSD, post-traumatic stress disorder. So when you're dealing with these symptoms, think about it this way. When it comes to medications, I know that there's a stigma with mental health, but if you had a flu, if you had a throat infection, right, you would go to your primary care, you would go get some antibiotics and deal with the root of the issue. And then you would take some Tylenol and Robitussin to deal with the symptoms, right? So you can get through your day-to-day life, right? Um, Same thing with mental health. This is your mental health hygiene, right? It's mental health. So emotions are a very normal part of life. They're a gift and I believe they're a gift from Allah because they guide us. They show us that, okay, anxiety is that yellow signal at the traffic light saying, okay, something's off. I'm afraid of something. It's always usually a fear-based situation, fear of not having control or losing control or the unknown. And sometimes it can cause a clinical change in your neurochemistry. So it's okay to go to a doctor and say, look, I'm having, these are the changes, hormonally it can affect you. A lot of times when you're a patient, you're on, especially with breast cancer, some of the medical management long-term treatments they give is um, specific to the type of cancer, they may give some hormone therapy and hormone treatment. So your hormones may get affected. You may go into medical menopause. So all of these things, all of these different areas can impact your emotional health. So it's not uncommon for patients who have a cancer diagnosis to get on a mood stabilizer or an anti-anxiety medication, because it's like it takes off the edge. It helps you function better. You know, it alleviates those symptoms. It doesn't mean it's a long-term situation. You're dealing with a very intense, chronic, emotional and physical and spiritual distressing event. And so you want to look at it holistically, like how can I manage and what can I do to cope better in all of these areas, emotionally, physically, mentally, spiritually? What do I need to do to help a better outcome, right? So if I'm feeling anxious, there's a, you know, if you feel uncomfortable taking medications prescribed by a physician, talk to your physician about maybe some other holistic remedies. Work with a counselor on some anxiety management techniques and stress management techniques, right? So there's a lot of opportunity to help better care for yourself when you're dealing with chronic stress and the acute stress, and as well as the chronic stress coming from trauma.
I think I want to go back to that menopause thing that you said. Could you explain a little bit more what that was? Because I know bleeding, like our uterine bleeding is impacted by our emotional state. Like I know
Oh yeah.
this because when I was taking care of my mom those few years, I had uncontrollable periods.
Mm-hmm.
Like they were so bad. And I was becoming anemic
Mm-hmm.
and trying to get, deal with it, going to the gynecologist and all of that stuff. And they couldn't figure out what was going on. And I talked to one of my friends who's a physician, and she's just like, Sadaf, it's stress. Like you are experiencing so much stress because I wasn't resting, I wasn't sleeping, I was worried, I was always like doing something, right? And that it really impacted me physically,
Yeah.
and I wanted you to just explain a little bit about what that menopause thing
Sure.
was.
So there's a couple of components. One is, if you look at it from what you just said, is the chronic stress, right? When you have a buildup of stress, first of all, stress is so bad for cancer. It lowers your immune function, and it does a lot of, it challenges your body in healing. So that's why stress management is the common denominator in a lot of chronic health related issues. And breast cancer is looked at as a chronic health condition for the most part, right? Depends on when you're diagnosed and all. So it does, our emotions are directly related to our physical health and vice versa. So if you know that you're dealing with, you have to pay attention, you have to build that self-awareness, pay attention to how your body's responding. If you're having uterine bleeding, if you're becoming anemic, it's literally like symbolic. Blood is symbolizes life force. It's literally life force being drained out of your body. So that stress is symbolic of your emotions and what you're feeling and how your body is responding to it. So you want to look at that and pay attention to it so you can get some help with it. There's a lot of naturopathic physicians. There's a lot of, you can go to your doctor and let them know exactly what's going on so they can help address the situation. But also dealing with the mental health component of it will help alleviate a lot of those symptoms. People respond differently to stress. So that's one big component. And grief is held. I've worked on a little bit of research on this on my own. So grief is usually held in a woman's womb and in their reproductive organs. So when we're grieving, or when we have anticipatory grief of, anticipating a loss or a grief in our family or someone we care about, it may impact your reproductive system. So that's one big major component of how emotional health and your physical health are linked. The other part of it is, as a patient, you're dealing with, like I said, the medical menopause part, where they actually they give you medications to suppress certain hormones, specifically estrogen, which puts you in a medical menopause. So you're dealing with the emotional roller coaster of not only everything that you just went through from the time of diagnosis, until, you know, you're at a place where it's now you're in survivorship state. But it's the emotional roller coaster, you know, and anything can trigger it. That's when the medication management for, you know, for the anxiety and depression can also come in and be helpful. So looking at it from a holistic perspective of how what you can do to help yourself emotionally, mentally, and again physically and spiritually is a big, you know, I'm a big advocate for holistic health, right? Whole person health model. So you want to look at yourself and your loved one as, okay, what is happening, right? And don't undermine what's happening either. What you're dealing with is not, you don't, a lot of times caregivers feel like they have to fix it all. You don't have to fix anything. You just have to go through the experience with your loved one and be present. Just be physically and emotionally present. And if you don't have the emotional space to be present, then seek some counseling support, seek some spiritual support so that you can create the space to be available for your loved one.
Thank you. And I think all of that is really important. And gosh, I wish I had heard some of this before. But like you said, we don't talk about it. Like we just
Yeah.
don't talk about these
That's
things.
and that's the thing. You know, I was diagnosed with an autoimmune condition when I was very young, at 10 years of age, and I've lived through, you know, my young puberty years of getting chemotherapy, 4 years of chemo. So it's, you know, although it wasn't breast cancer, it was a chronic health condition I've lived with pretty much most of my life, right? So it's not just a professional thing for me; it's a personal thing, and it's part of my journey. And you know, and I truly believe we go through these experiences so that we can learn from it. We go through our own boot camps, and then how can we help others, right? And this is what we're doing here, right?
Yeah.
All of us.
No, exactly. And I think that's why the women's health conversations, these things are so important to me because I just feel like one little seed, right? Like one piece of information that any of you that are listening get, then you talk to your friends, you talk to your
Mm-hmm.
mom, you talk to your kids. And I think that spreads really. The more we know about these things,
Absolutely.
the easier it is to just, first of all, prevent those same struggles with other, and the people that you love. And then just um we don't have to keep going through it alone ourselves repeatedly,
We don't.
everybody just going through the same thing.
And I will say, and I will have to log off in just a couple minutes, but
Yes,
I
we're
will
almost done.
say that one thing from my friend's experience, and I will share her brief story quickly, is that there was a family history of breast cancer. Her mom had it, her sister had it, and they all went through um, the treatments and all that. But a lot of times we go in. Sometimes we are like, oh, it's not going to happen to me, and we don't put ourselves first because we're taking care of everyone else, and we're not taking too long to go get those mammograms. Get your mammograms, get yourself checked out, and it's nothing to be afraid of. You know, it's being proactive. It's a practice of self-care. It's a practice of honoring your body. So, you know, that way, if God, you know, God forbid something does happen, you have the capacity to know, okay, now I know what I need to do. I have resources, I have support, right? But don't, it does run in families. There are certain genetic factors that are linked with breast cancer. So you have to be very mindful of that. And sometimes it may skip generations. So that's why, you know, and culturally, like a lot of times our mothers didn't go to their doctor's appointments, didn't go for their gynecological exams, right? It's like, oh, I don't need to go to the doctor unless I'm having a baby, right? That's the only time they're maybe going to the doctors. But educating our elders as well, our mothers, our aunts, our sisters, our nieces, anyone, even like you said, breast cancer is not just for women, it does run in men as well, you know?
Yeah.
So learning about it and educating and taking away that fear and knowing that you have support, you're not alone in this. Like, we're all women, we all have the same stuff.
Yes,
So we
exactly.
just have to take care of it.
And we're here as far, honestly, you can DM us and send us a little message if you have a question for Abila, a question for me, for anything really, like, hey, I'm going through this. I don't know who to talk to. And then
Yeah,
we know so many people and we
yeah,
will get
absolutely.
you a resource, right? And I think it's okay to ask for help, like you mentioned. I had wanted to talk about the whole other part of this journey is like, okay, after treatment, and or what if we lose a loved one to cancer, all of these things. But inshallah, that will be a conversation for a different day, because that is such a big piece of this, right? Like living life with
After.
after
Mhm.
treatment, right? And
It's survivorship. Yeah, it's
yes.
survivorship. And a lot of times, I've actually recently had one of my clients say to me, she said, I can't see myself as a survivor. I have to use the word remission because of that
Mm,
fear of reoccurrence. So that is a very good conversation to have as well, is that life after. How do you move forward? It's just like how people said in COVID, I will leave with this is, oh, I want life to go back to the way it was before COVID. Life will never go back to the way it was before COVID. You have to learn to move forward, and how you've transformed, how you've become resilient, and how you what you've learned for yourself, the silver linings. So always remember that, right? Remember that we are given challenges, and how we respond to it in hope and faith. That's what gets us through.
inshallah. That is a beautiful, beautiful way to end this conversation.
Mhm.
If anybody has any questions, you can put them in the chat while I just say a few little things. And I wanted to end before 1, so inshallah 4 minutes. I I wanted to let you know about some subsequent Women's Health Matters conversations we're going to have now that we're back. The plan is to have in November diabetes conversations. So many women are struggling with diabetes, living with diabetes, right? So just what does that look like? How do we take care of ourselves, our nutrition, and just those kinds of tips. So inshallah, that'll be November. And then December, we're going to go into gut health, stress. So stress, gut health, immune system. Like, what is that relationship and how do we deal with this? Because again, women are living with IBS and all of these things that are just so difficult. So just kind of like, how do we see the links in between these three things and navigate that whole thing? So those are a couple of the conversations coming up. We have a whole beautiful women's health task force back up, and we have a lot of great things planned. So please stay tuned, follow us on our social media and everything. And if you have any questions, again, please do email us at info@mwo-orlando.org, and we will forward those questions to Abila. And or anything, honestly, you have a question about, let us know. Thank you all for joining us. I'm going to go ahead and
Thank you
stop the
so much.
recording. Thank you, Abila, for your time.